I'm Dr. Jacqueline Bezic. I am a periodontist and a family dentist. Today I like to talk about dental implants, since that's one topic that we see patients interested, and it has been actually a revolution when we were able to start replacing a tooth with dental implants. This has been in dentistry for over 40 years, and now we know more and we are using it frequently for different purposes. So if you are missing one tooth or you're missing the whole dentition, dental implants can help to create an anchorage and replacement option. Now, since it is a screw that it gets to be in the bone, it's a surgical procedure, your health should be in a good condition, especially as far as the bone healing is concerned. So certain category of patients could be higher risk for implant placement, so your health condition should be under control. But as we are learning more, there are more patients that we can help with dental implants. Now, one of the issues that I am very passionate about is that even though we know how to replace a tooth with dental implant, doesn't mean that we should not save the teeth. So nothing is going to be as good as your natural tooth. So first foremost, we should try our best to maintain your dentition, and when for any reason that we cannot no longer keep that, then we can use dental implants to replace it. And one of the problems I feel that is in our field nowadays is that sometimes the excitement about placement of implants is taking over saving the tooth. And even though it's an option that is there and it's a great option, I still strongly believe that since our life is prolonged, there are always, when you have a first choice, you save the tooth, and then if it's not, then you go for dental implants. So dental implants are screws, as I mentioned before, that they are placed in the bone and used as an anchor, and we put crowns on them. We can put that as an anchor for a denture. And the critical part is that the hygiene around the dental implant is even more important than your natural dentition. Since dental implants don't get cavity, doesn't mean that you need to neglect them. You need to maintain a very good hygiene to prevent gum disease around the implant. And the gum problem around dental implants are actually much harder to treat than the natural tooth. So if you are missing a tooth, you're interested to know more about if you're a candidate or not, or if you have implants that you're wondering are they in a healthy condition or not, please reach out to your dentist. And if you don't have someone who know about this type of techniques and you would like us to help you, you can reach us at MetroDental Health. Our phone number is 703-934-4474, and in DC 202-363-5720. We have 2 locations, Fairfax and DC, and we will be more than happy to help you.